All right, everyone. We're going to get started today. Thank you for coming. And if none of you have been here before, welcome to the archives. Today we have Julie Bushmaker with us, and she'll be presenting about nursing and nurses that went to St. James for school. St. James Hospital School of Nursing started in Butte, Montana in 1906 with 4 nurses graduating in 1909. A total of 1,046 graduates received diplomas from St. James over the next 64 years. In 1969, 59% of all nurses employed in Butte were graduates of St. James. And the last class of 19 nurses graduated on June 5th, 1970. And again, thank you, Julie, for talking, and take it away. Okay, you're good.
Hey Tyler, how do I turn on?
I should probably turn it.
Okay, can you guys all hear me now?
Good.
No. Hi, John. Hello, hello? Now you're going to hear me.
Okay.
Well, I'd like to, first of all, thank you guys all for coming. I am going to hand out, or have handed out, a list of all the nurses that I could identify that I worked with, which was pretty amazing by the time I sat down and started looking at names and who they all were. So if anybody didn't get this list, raise your hand, and I got my assistant right here helping to hand those out. Also, these are wonderful little pamphlets, again, that St. James handed out at a tour that we did of all the old St. James, St. Patrick's Church, and also the cemetery. So I'll pass those around if you didn't get one. Did you guys get one?
Hey, Julie. To your right. Other way, sorry.
Right.
You're good. Yeah, that's good. Thank you.
Well, first of all, I'd like to thank Aubrey. We were on this tour together, on this bus tour together, learning about the inside of the old St. James, because I had never been in there. I worked at Mercury Street Medical, and I had been into the area where we used to put the old medical records, which turned out to be the chapel, okay? And so that was really cool to see. But during that period of time, Aubrey, who is the director of the archives here, said, geez, Julie, wouldn't you love to do a talk on the nurses at St. James? And I said, well, I'm going to have to really brush up on that, because I could tell you how wonderful all those nurses were, but I'm not sure I could tell you the backstory on all of them. But I found some backstories on all of them, and that's what I'm going to share today. I'd also really like to thank Tyler for doing this. This is really, to me, Emmett Murphy's grandson, right? So there's your Butte connection, you guys, Tyler. Also, Jen Peterson, she works here at the archives. Jen dived in one day with me to do a deep dive for all the resources that are available. Because in any of my talks, I always try to tell you that your biggest, most wonderful thing that ever happened in Butte, Montana is this archives, and the library, of course, and the hospital, a few other places. But right now, I just want to tell you there's so much here, and I've only kind of found the top part of the nurses at St. James, so come up and help me someday. This actually was the pin that the nurses received when they graduated from the Sisters of Charity School of Nursing here in Butte, Montana. The school went from 1906 to 1970. The first class, again, didn't graduate until 1909 because it takes 3 years to prepare a nurse at that time and date. That was the diploma nurses. So I'd just like to thank you, extend my thank you to the graduates of the St. James School of Nursing and the Sisters of Charity of Leavenworth, Kansas, for the care that was provided and still is being provided to the citizens of Montana, past, present, and future. Also to all those people that come off the interstate with accidents, everything else that occurs that we do without thinking. I'm just going to give you some of my resources that I found here at the archives. First of all, I found the Angels in White book, and we're going to be talking about this a little more in detail, but this was kind of like the Bible for me finding everything that I needed to, that I could dig deeper in the archives. So I'm going to pass around the archives one, but we need to get this back. Very, very important, because I've talked to every nurse that I know that might possibly have this, and I tell them if they die, make sure they put their name on the front of this and say it goes to Julie Bushmaker, okay? Because that's how bad I want it. I've talked to second edition books. They say very, very rarely do they ever get a copy of that in. Feel free to look through it. Here's the library's copy that I had on extended loan for a while. Some things that Jen and I found. These are called vertical files. In these, here at the archives, what they have is they have old newspaper articles, they have bulletins that people have put in or brought to the archives and kept. This one is the Sisters of Charity School of Nursing. Out of this, I found 3 or 4 articles that really helped me find more in my research. Another vertical file was entitled The Grotto of the Lourdes Shrine, that we'll be talking about, that's currently still at the Mercury Street Medical. And the last one is a vertical file just on St. James, and it has like the plans from St. James. It has what's called architectural inventories, and these are available at the archives. If you have a house that's in the historic district in Butte, you can get the whole background of your house right with this. So I'm going to pass that around just so you can take a look. The next thing, Sanborn maps. Those were too big for me to carry. I just broke my arm about 8 weeks ago. So those are great big huge pictures of all of the buildings, all of the area in Butte. We have those for probably 50 years, I'd say, 50 years altogether, and those can also be found online. Birth and death records. This is what a death record looks like, and this is for one of the sisters that died, and we're going to be talking about her in more detail, but she was the reason for the shrine that is up in front of Mercury Street Medical that used to be in front of the dormitory at St. James. So I'll pass that around so you can take a look at one of those. Naturalization records. I haven't used any in my talk for this, but one of the sisters that I'll be talking about that was a student, she was naturalized in Leadville, Colorado, but we have copies of we have records for all the naturalizations during a period of time for people that came from all the countries in the world to Butte, Montana. Polk City directories, that's what these look like. These were printed every year. We have a number of those here at the archives. The one that I have right here has a picture of St. James in. It also told me how many hospitals were located in Butte every year that I looked. It could tell me your person's name if your family members came here in the 1890s. Their names would be in that book. Where they lived, what mines they worked at, what they did for a living are listed in there. Those property inventory records are just like those architectural records. Those are available here. We have cemetery databases, and I'm going to be talking about a number of the nurses that work there, but I'm going to pass these around because these are from a site that is a free site called Find a Grave, and with this Find a Grave site, what I'm doing is developing now just a separate cemetery for the over 1,000 nurses that work at St. James, if I can find out all their names, okay? And so I'll be putting them into a private cemetery. And this usually has like an obituary, there's a picture of their stone, it has sometimes a picture of them, it also has death certificates sometimes available, and this is a free site, it's called Find a Grave. Oral histories, when I was researching the cadet nurses, I found information in this book called The Mother Lode that Ellen Crane and Janet Finn put together, and this recognizes the women in Butte that made contributions to Butte throughout the years. In there, there's two areas. There's information on the Sisters of Charity of Leavenworth and the hospitals. The second one is information on the cadet nursing program that we'll be talking about in just a little bit. And one of the things about the cadet nursing program is that they did oral interviews with 6 women that were cadet nurses. So this is really hard to find also. Bernie and I were just talking about trying to find one. The second edition, I think, occasionally gets those in. Newspapers, you guys have newspapers back from the beginning of time almost in Butte, Montana. And those are available for you to look at. They also have a subscription service called newspapers.com, and you can print out pictures in the newspaper, and I'll show you some of those that I printed out. Books, let's see, if you want to just know more about the Sisters of Charity, these are some books. Come North, We Came North, talks about the Sisters of Charity. The Cadet Nursing Program, they have a book here that you can look at. The Butte Influenza Crisis, there's a book here. Nursing in the Past, there's a book there. Those are kind of the books that I referred to in this. Oh, back one more. Most importantly, I did talk also to the archivist at the Sisters of Charity of Leavenworth in Kansas. Asked her if she had any historical information on 2 of the sisters that I was looking for. She sent me right away that day their whole archive file on each of them. So if any of you have sisters that you're interested in researching, you can get a hold of Tanya Crawford, and she can send you, if they passed away, their whole history. It's amazing what were in those. So these are the 2 books that I use primarily, The Angels in White and The Mother Lode, for a lot of the information. Who put together that Angels in White was a lady by the name of Claire Louise Holman. I'll try to talk today. Claire Holman was an inspiration to everybody. She was born here in Butte, the 28th of April in 1933. Her parents were James and Alice Daly Combo. She graduated from Butte High School, and then she went to St. James Nursing School in 1954. This period of time, she excelled there also. Then she went on to Carroll because the nurses had an option at that time. Once they completed their 3-year diploma program, they could go 1 more year at Carroll College and they would get their BSN, and she got hers in nursing education. We were very fortunate that that happened because when, after a period of time, she came back and she was the person that started the practical nursing program here in Butte and taught at that program for 20 years. She was assistant director of nursing at St. James. She also worked at Warm Springs and Galen doing instruction, also nursing instruction. And her final job was working with her buddies from that 1954 class. She started with them working for Beta Factor Home Health, and that's where she retired from. She married Cy Holman in 1959. She was the mother of 2 sons, and she died in Butte in 2022. I was really lucky to see her out at the Springs where she was living about 6 months before she passed away. She was just as sharp as she ever was. Just a great lady. Any of you guys remember Claire? Yeah. Great. Her niece, Kathleen Wolf Lane, she gave us permission to utilize this Angels in White. Is she here today by chance? We're going to try to get an oral interview with her just to find out, because she, along with Gail Astle, Claire, they worked on this program for about 2 years. She did a lot of the computer work, she said, but they brought her all kinds of information, put it together so that this book could be saved for the rest of the people in Butte, Montana. So the School of Nursing, I just want to kind of give you a background a little bit. These actually are the, whoops, back one. All right. These are the sisters that were the administrators throughout the period of time from 1881 to the time when Sister Mary Serena was there. That was at the time that they finished writing the book, The Angels in White. The sisters came to Butte as healthcare pioneers. I thought they all came up on a ship, okay, from St. Louis. Not so. Actually, there were hospitals that were started in Leavenworth, Kansas in 1858, and then in Montana, St. John's Hospital in Helena was started in 1869. Deer Lodge Hospital was started in 1873. And then if any of you have been to Virginia City, you know there's a little hospital down there that was started in 1876, because that was when Virginia City was just, you know, on the map for finding gold. And then from there, 2 sisters were sent to Butte in April of 1881. They were asked to come by the priest at St. Patrick's to establish St. James Home. And that's what they called it. They didn't call it St. James Hospital at that time. It was called St. James Home. And the two sisters, one was assigned to obtaining property, which you know that they bought down by St. Patrick's Hospital, or St. Patrick's Church. And they had to negotiate contracts with the county to buy that property. They had to negotiate to build the home that they were planning on building. And they also had to negotiate with the county to get payment for people that couldn't afford health care. And so they started in 1881 contracting with the county and the city of Butte-Silver to help take care of the poor. Sister McLaughlin, she had a really bad job. She had to go beg for funds, okay? But in a period of about 6 months, she went from the front of each mine to the smelters, and she was able to raise $8,000 to construct what at that point was a 2-story home on Idaho Street, the same place where the old St. James is now. Then they called for 3 nursing sisters, since they had the property, the contracts, you know, the money, okay? They got 3 nursing sisters, that's what they were called then. And there were 2 that were blood sisters, Sister Serena and Sister Hillary O'Connor. And they came along with Mary McMahon. Yeah, and you can see their pictures. You can see their pictures in here. Okay, so they came together. During this period of time, though, you have to remember that in 1873, the first U.S. nursing school opened then. So this was not long after that. That was in Bellevue in New York City, and it was based on Florence Nightingale's principle of nursing. So, you know, they were very forward-thinking women. In 1885, the 3rd floor was added. So they were able to take care of 100 patients at that time. The population in Butte at that time was only 22,000. And remember, during that time, silver was king. So we kind of passed that gold time. We were into mining silver here at the Trevona and other mines here. And silver was the commodity at that point. Right away, 1889, they added the second wing. And then, if any of you remember 1895, there was a huge warehouse explosion and fire. Can you imagine all of those people coming into a hospital and trying to seek care during that period of time? And, by 1913, there were 5 additions added to that hospital. So the care of the miners was one of the major reasons that they were brought here. The sisters were very astute businesswomen. In 1880, again, they let that contract for the construction of the hospital. They negotiated with the county to care for the county poor. They were able to collect $3,229 from just 7 mines in 1898, but by 1914, they had negotiated with 32 mines to provide for miners' medical expenses. They negotiated throughout the years with the powerful Anaconda Copper Company. Every so often they'd have to go back and negotiate contracts, especially if their coffers ran a little bit lean. And these are just some of the mines and some of the smelters that they had contracts with. Each mine, they provided emergency equipment, and the student nurses would visit those mines. They went to the Leonard mine as part of their sociology class in 1949, just kind of see what the miners were living with. The hospital had a large miners' wards, and they would all live together. When I looked at the copper camp, that's a book that the archives has here. Usually it has a story about everything. There was one story in there about St. James Hospital, and it was about a bunch of miners that had alcohol, can you imagine, brought in to the ward. They locked the nuns out, they locked everybody out, and they had quite a party all night. Okay, nuns finally got in the next morning. That was the only story that they could tell about the Sisters of Charity, miners' ward, anything. I thought that was interesting. One of the nurses that were interviewed talked about each Thursday that the miners' union supplied, as a benefit, candy bars to the inpatient miners that were there, and those were often shared with the nurses. In 1906, they decided that they needed to start a nursing school. The sisters prior to that time provided all the care. They cleaned, they cooked, they served the poor for over 25 years. And the training for the sisters at that point, one sister would just train another sister, and that was called sister nurse training, okay? They weren't accredited, nothing happened like that, but that's how they were trained. I'm sure they were trained very well, okay? If any of you have been trained by a sister like me, okay, you realize that you got good training. The miners' wards were the areas, again, that were the major areas. Let's see if I can go back here. Okay. In 1881, they had that contract again with Butte-Silver, and they also contracted $1 per miner per month for all the services, except they didn't care to provide for venereal disease or intoxication. So if you fell down a shaft or whatever and hurt yourself, fell down in the mine, broke an arm, broke a leg, they would take care of you, okay? But if you had venereal disease or intoxication, I don't know where in the heck you went. You had to get a private duty nurse and a private doctor. 1906, St. James Hospital was there, but also there was another hospital called Murray Hospital at that time, and The other thing was that there was a county home and a farm where they raised food, but they also took care of indigent people, indigent minors, and indigent people that could not provide for their own care. In 1906, the population of Butte was about 59,000, and remember during that period of time, copper was what the commodity was. 1906 again, St. James was founded. 1909, the first class of 4 graduated, and by 1970, 1,046 were graduated, and during that period of time, there were just these 13 directors. The only one that wasn't a sister was this lady right here. So this is what St. James Hospital looked like in 1889, right here. By the time they were ready to start their nursing program in 1906, this is what it looked like. Michelle, aren't you glad you wouldn't have to nurse for that many people with just fellow sisters? Okay. Murray Hospital actually is located right over here. This was where Murray Hospital was at. There are a couple little buildings, but this is the archive building right here. So where you parked your car more than likely, that was where Murray Hospital was at. And let's see what year. They actually had a nursing program. That's what their nursing graduates looked like. Not sure about those caps. Everything else looked good. Murray Hospital actually
Hey, Julie.
was.
It's just getting feedback. If you could just move this
way?
a little bit.
Okay. Murray Hospital was
There you go.
started in 1896, so 1881 was when the sisters started their hospital, and that lasted until 1933. But they actually started their nursing program earlier, okay, than what St. James Hospital did. So they were in business producing nurses for about 10 years before St. James got into the business. From 1906 to 1910, this is the information that was in the newspaper about they were going to start a nursing program here. The first director was Sister Mary Rita Sullivan, and these were diploma nurses. In the state of Montana, there were 22 diploma nurses throughout the years. They kind of fell off. There were 3 that dropped out in the 1920s. In 1930s, there were 9 that quit having nursing programs. In the 1940s, 2 quit. In the 1950s, 3 quit. In the 1960s, 2 quit. And when St. James stopped producing diploma nurses, there were only 3 schools in the state of Montana that had diploma nursing programs. Those were Billings, Butte, and the last one was Missoula St. Patrick's Hospital. So in 1905, the campus for the community kind of moved from uptown Butte down to the Flats area. The red light district was still up here in the uptown areas, and that's where St. James also got a number of their nurses, or a number of their patients from. Not their nurses. You had a choice at that time. You could either be a prostitute, you could be a teacher, you could be married. These were the women's choices. Let's see, you could be a nurse, or you could work in at Hennessy's or as a shop person. That's where you could work. So, okay, I'm clarifying that again. They weren't going out to the red light district and getting nurses. 12,000 men worked in the mines at that time. The payroll was $1.5 million a month, so there was money here in Butte. There were 42 churches, 25 public schools, and 7 church schools. In that 3-block business blocks, you have to remember that Simon's was there at that time, the Butte Public Library. What happened during that period of time was that there was a huge fire that wiped out Simon's department building, the Butte Public Library, and caused a lot of people to have to come to the hospital too. That was called the $1 Million Fire. So there's a lot happening in Butte during this period of time. The very first class had 4 students that graduated. Again, that was in 1909. One of the persons that I fell in love with, one of the nurses that I fell in love with, was actually a sister. Her name was Catherine O'Sullivan.
Oh, yeah.
Her name was Katie. Anybody remember her or know her? Yeah, you do? All right, this is great news. She was actually born the 15th of December, 1878, and she was born in a town about maybe a 15-minute walk from where Father Burke was born in. Okay, he was born in Bandon, and one of the things, she had 4 sisters and 2 brothers, besides Katie here. One of her sisters moved to France and was also a sister, so 2 out of the 6 children were in the church. In 1896, she left Ireland, and on the 12th of May, she entered the Sisters of Charity of Leavenworth as Sister Mary Anacleria. In 1899, she took her first vows. At that time, they sent her to this new sanitarium in Las Vegas, New Mexico, as one of those sister nurses that we talked about. She still wasn't a professional nurse at that time, but she found her passion in surgical nursing. She was one of the 4 graduates of the first class of the RNs in 1909, and in 1921, she was naturalized in Leadville, Colorado, because that was where she was sent to after she was here in Butte for a number of years. She served in Billings, Butte, Helena, and Anaconda, Montana, and then Grand Junction in Leadville, Colorado. So she was pretty much the mining nurse. She was often present at the bedside for the sick and dying. The nurses said that she would be working from 7 in the morning till 7 at night, go sometime during that period of time, get a few cat naps, and then she would be out on the wards, because she had like a 6th sense that a lot of nurses do about when people are going to pass. And so she would go and sit by their bedside until they passed. The student nurses said that they used to call her the Holy Ghost, okay, because she was very tall, very pale, okay, and she could sneak up on them without them knowing. The only way they got tipped off was just her rosary beads making noise. Father Burke and the students said that she was a good egg. So you guys, if you were called a good egg by Father Burke, I think that was probably a good thing, right, Bernie? Didn't call everybody good eggs, but he really liked Sister. On the 11th of September in 1963, she died in Leavenworth, but her job after she went out of nursing was to work in the chapel at Leavenworth, and she repaired, they said, all of the sacramental cloths and made new cloths for all of the chapel. Pretty amazing woman, right? I think 10 years before she died, she actually got to fly back and visit her family in Ireland. So that was kind of a cool ending. And from 1911 to 1920, in 1909, the Red Cross was formed in the United States, and a number of nurses that graduated from St. James Nursing Program went into the Red Cross as Red Cross nurses. In 1910, 51,000 graduate nurses were in the United States, but most of these worked as what they called private duty nurses. They didn't work in hospitals per se, all of them. What they would do is they would work in persons' homes, they would work in public health, and a few of them worked in the hospitals, primarily in the surgical areas. You got to remember, Butte was kind of a wild and crazy place at that time, still is. But in 1912, there was this miners' picnic where thousands of people were injured from beer bottles. Can you imagine anything like that? That was August 20th. The Union Hall was dynamited during that period of time. Martial law was implemented, which was rescinded 16 months later. The Catholic hospitals, there were only 541 Catholic hospitals at that point. And how did they provide care? They provided it by the free work of these women that were going through nurses training. These nurses provided free care, plus also the nuns who'd taken the vow of poverty. So that's how they were able to finance Catholic hospitals. The Pennsylvania mine incident, there were 21 miners here in Butte and 10 horses that were asphyxiated. The miners' wages at that time were $4.75 a day. This is during the period of time of the Granite Mountain mine explosion, where 15 people were dead. Again, World War I was occurring from 1917 to 1918. During that period, 11,603 men alone in Butte signed up for the draft for the selective service. There were 15 Montana hospitals, again, at this period of time, down from that 22 that had nursing programs, and out of that, only 265 nurses were graduated every year. The Granite Mountain speculator mine disaster, there were 163 dead, but many injured. Mary Manley talks about this in one of her stories, and I'll just read you a little bit of that. I think I passed. She just said that basically they just kept bringing people in, not only to St. James, but there was another hospital in Butte at that time, and they would bring people there. So there was St. James, there was Butte Deaconess Hospital that just had opened up, and there was the Murray Hospital. So all three hospitals were inundated with people that had been injured and people that were injured trying to rescue those miners too. 1918, the Spanish flu hit Butte. Spanish flu infected 15,000 people here in Butte, and 1,200 people died. You guys remember what COVID was like? Not at all like these numbers. I don't know how they ever took care of that many people. 1918, these nurses were started to be required then to take state boards. That was their certifying boards. And that lady that I was talking about, Mary Manley, she was very surprised. She said, I got the highest score in all of Montana. But she accredited it all to the great instruction that she had at St. James. Population was anywhere from 90 to 100,000 souls here in Butte that they had to care for. This class here alone, this is 1916 class, and this is one of the instructors. All but one of these joined the Red Cross to help provide care. The lady that didn't, her name was Marguerite Mullins Hubert. She was born the 28th of January in 1897 in Butte here to John and Nellie Coleman Mullins. And she graduated with the 6 nurses that I just showed you, the 5 that went to the Red Cross. She decided to stay home. Her parents owned part of the flats area out by Wynn Avenue. And she worked, after she graduated, as what was called the private duty nurses. That was underneath a physician. The physician gave them direct orders. They used to carry all of their syringes, their bandages, their opioids, okay, because they weren't regulated at that time, in their little satchels, and off they'd go. She said it was so safe in Butte, even though there were about 90,000 people living here in Butte, that if somebody died at 4 o'clock in the morning, she could get on the streetcar, ride to whatever part she needed to in Butte, and never was ever hassled. She said that she cared for people Red Light District, she went to the Cabbage Patch area, she went to Grand Homes in Butte and never ever had a problem with having anybody accost her. She attended many injured miners and talked about those. She carried around this book, her procedure book, okay, that was called the Private Duty Manual, and she would write little notes, she said, in there for things that she found that worked well for taking care of people. She was the head nurse in Central Services at St. James Hospital for a number of years. That's where you get your sterile supplies from, okay? That's where they sharpened all those needles that they used to carry around in that bags. She became the state president of the MNA, and during her period of time, they dropped, the nurses were required at one time to work 20 hours a day. They dropped it back to 10 and finally to 8 hours during the time that she was state president at the MNA. She married Nicholas Hubert in 1920. They had no children. She died on the 28th of October in 1982 in Butte at the age of 85. She left all of her nursing caves, everything that she had relating to nursing, to Mary Thurman's mom, Ann Thurman, and she then gave it to the World Museum of Mining. In 1917, the sisters got enough money together that they built the dormitory, and the dormitory now is Mercury Street Medical. It was, the first class that lived there was 1918. The construction cost $46,000 in 1918 funds. They had at that point single rooms, they had large closets, they thought it was grand. Electric, steam heat, sunshine, ventilation. Remember, a lot of people at that time lived in small cabins here in Butte. They had telephones, they had a reception and a library area, and that's where the reception area was the only place where visitors could come and visit the nurses. They couldn't go into the dormitory areas. This was closed as a dorm in 1963, so 7 years before the program was closed, the nursing program was closed. Mercury Street Medical purchased it and renovated it in 1990. Prior to that time, I think my husband's office was about right here. I think MSE had it for a while as offices during that period of time. This is what it looks like now. There's still a plaque there and underneath the National Registry. Okay. In 1921 to 1930, a lot of things were happening still in Butte, but during that period of time, remember the mining kind of decreased. There were, 1921, there was a miners' strike. The wages were $4.25 an hour. 1922, that's when insulin was discovered. So TB, venereal diseases, and alcoholism were rampant, and so those miners' wards were full of those boys having little parties, I'm sure. 1922 was when the sisters in the hospital, they went to white uniforms. In 1923, the bed capacity at the hospital was increased to 173 beds. They probably put 2 or 3 people in the same bed or same rooms. The miners' wages in 1929 had gone up to $6 an hour, but then, or $6 a day, but then the stock market crashed. In the late 1920s, the U.S. had 294,000 trained nurses. I think we're like 2 million now, I think is what there are nurses now. They had 150,000 untrained nurses, so not everybody that was nursing were trained. 47,000 midwives, because still during that period of time, a number of women still delivered at home. And they had other workers like orderlies, ward aides that helped out. M&A approved, again, that 8-hour work day. They also got group insurance at that time, and they were allowed a few hours off for social life. So I went over to visit a friend of mine, and this nurse jumped out at me. This is Catherine Harrington Mulcahy. She was born December 25th, 1904 in Utah. She was one of the 11 graduates during the 1928 class. Her father died of minor's consumption in 1916, and so she was 12 years old at that time. 2 years later, her mother died of the flu. She went to nurses training again and worked at St. James and at Murray Hospital as a private duty nurse. And private duty nurses were also, if somebody had enough money, if they didn't want to have just nurses coming in and out, they could hire one nurse to stay in their room, to clean them, take care of them, clean their room, provide all their medications. Those were called private duty nurses, and a lot of people did that at that period of time. She worked 12 years as in the Butte Public Health Department. She attended the University of Minnesota after that for endorsement in public health nursing. So she went beyond that 3 years of nurses training. In 1928, she married Maurice Dugan Mulcahy. They had 3 children, and she also was the sister of John Yank Harrington. And if anybody remembers Sister Mary Harrington, she was about this tall. She used to work at St. James too. She died on the 31st of January 2000 here in Butte, Montana. Tony Seckham would be her daughter-in-law. Okay, so daughter-in-law, granddaughter-in-law. From 1931 to 1940, general staff nursing took over. That's where the hospital actually employed nurses to take care of people rather than have those private duty nurses or the sister nurses taking care of them. New York Stock Exchange crashed during that period of time. 1931 was the Depression. 1933, they repealed the prohibition on alcohol that was in place for 13 years. But one of the things that happened here in Montana was in 1935 there was a major earthquake and it damaged the hospital very, very badly. St. Anne's Hospital School of Nursing closed during that period, so the St. James nurses took those nurses in for the rest of their training. SOPA was just introduced in 1938 at that time, and in 1940 this is one of the largest remodels that St. James had. The money was raised by the Anaconda Company. The Butte community pumped in a lot of money, and it was matched then by the Mother House. This is a picture of what the new lobby looked like. And that's what the nurses looked like in 1943. You know, this is kind of looked like where all the diploma nurses would have been in hospitals. About 54,000 people lived in Butte at that time. This is what the inside of the hospital looks like now. This is going through a renovation. This is the old St. James. There's Bernie.
We were going to talk about that.
Okay. This is what that chapel looked like, where I used to go get the medical records that I didn't realize was there. That was still here. That was what we found during our tour. They just took down the walls. The administrator at Mercury Street Medical took down those plywood walls, and this is what was behind it. The altar, the sanctuary, everything was still there.
So where is that located?
It's the inside of the old St. James, over on Idaho. Yeah, back behind Mercury Street Medical. And they're actually going through and renovating that now. They're tearing out a lot. If you go by there, you'll see they're constantly bringing stuff out of there. But it was amazing to get it on the inside, wasn't it, Bernie? Anybody else go on that tour by chance? Yeah. Yeah. What was your?
It was so cool, yeah. Well, he was born there, so we had to go.
Oh,
Yeah.
John was born there.
Julie,
Yeah.
you said they were renovating it.
Yeah.
What's going to be there?
I don't know. I don't know. We haven't heard. But I would guess probably apartment buildings. I don't know. Because they have taken people through for ghost tours and stuff like that. It seems like a perfect place for a ghost tour, right? But,
Oh, yeah.
yeah. It's gonna be cool to see what's on the inside. And I don't think they're gonna be tearing out any of that old lobby area. Beautiful, huh?
It's beautiful.
When I was looking at the nurses from 1931 to 1940, I had about 6 that were coming up that I really wanted to talk about. But this lady jumped out at me. Her name was Vivian Cornyn. She was born on the 3rd of July, 1917 here in Butte. Her mom were Frank and Anna Huddleston Cornyn. And she graduated in the class of 1938 from St. James. After that, she went to the University of Minnesota and to the University of St. Louis, where she got her BSN, Bachelor of Science of Nursing. That takes 4 years of training. She taught 1 year at St. Mary's Hospital in Minneapolis, Minnesota, until she got the bug to join the service in 1942. She served in France as a second lieutenant in the U.S. Army Nurse Corps as a flight nurse. I don't know if I'd want to be a flight nurse back in 1942 or not, but she helped evacuate people that had soldiers that had been wounded in Normandy Beach. She was taking them back to England for medical care during that period of time. She'd gotten news from Butte that her 14-year-old brother, John Edward, was ill. She'd asked to be able to come back to Butte to take care of him for a few months till he got better. During the time that she asked for that, and when she was granted the leave, her brother, who was 14 years of age, died. She did come back for the funeral, and on the way back to England, she was killed in a plane crash over Scotland. There was a big fog that came in. They couldn't land safely and did not land in safety. She was one of 20 people that died on that flight on the 28th of August, 1944. 27 years old. She's buried in England still. But if you want to, you can see her memorial out at the Butte American Legion block. She was the first Butte woman casualty of World War II. Again, second lieutenant. During that period of time, in 1936, there's a grotto that's out in front of Mercury Street Medical. It's called Our Lady of Lourdes. It was built in 1936. The replica is a replica of the grotto in Lourdes, France, and it is said that Our Lady appeared before a child Bernadette, Saint Bernadette, and that a fountain gushed from the rock with curative powers during that interaction. She had 14 visits, I believe, and in Lourdes they built a grotto, had Our Lady and the statue of Bernadette. The sisters wanted to do the very same thing. They got hold of a statue of the Lady of Lourdes when the earthquake happened at St. Vincent's in Helena. They got that statue, brought it to Butte, okay? Then they went out, sent those sisters out requesting funds again, and they built the grotto and secured enough money to get a statue built for Saint Bernadette there. And this they all did in honor of one of the sisters that had died. Her name was Sister Mertra Downing, and she was actually born in the Bear Peninsula in County Ireland, came here to Montana, and was the primary sister in Butte for 3 years. The miners loved her so much, and she had such a presence in Butte with all of the miners, probably because they were all from Bear Peninsula, right? That they were able to raise enough money to build that grotto. This is what the grotto looks like now. This is the May ceremonies that they have. From 1941 to 1950, every year they would elect a student, and they would crown do a ceremony in honor of the Lady of Lourdes, and the nurses, then they would have a reception, but that was a big deal, something they looked forward to every year. From 1941 to 1950, to help augment the nurses, they had nurses, practical nurses were starting to start practicing then. But one of the programs that they developed was this cadet nursing program, and that occurred from 1943 to 1948. During that period of time, penicillin was introduced in 1945. Mary McClafferty, which you guys may probably know, she administered the first dose 2 years before that to a 17-year-old boy in Butte. They did it by IV, so it was the first for administration of penicillin and the first of using an IV to administer that drug. During that time, essential metals were king. They used, mined for magnesium primarily in Butte during that period of time, my understanding, as well as copper. In 1947, the first collegiate class to attend the newly organized Department of Nursing Education at Carroll College was started. So you would go 1 year to Carroll College, and then you'd come either to Billings, to Helena, and you would then get your BS in your last 2 years. This is just a picture of them at the Copper Bowl having a good time during that period of time. The cadet nurses they realized in 1940, the nurses did, that there was going to be a problem. Okay, they needed to get a whole lot of nurses. So in 1941, when Pearl Harbor was attacked, that just highlighted that crisis. 1943, Congress passed the Bolton Nurse Act, okay, and it was signed by FDR in 1943, and they recruited nurses. I remember my mom talking about wanting to be a nurse because she was kept getting recruited through ads, through medias, through all the magazines, and they're lucky, they got a few. Here's one that you guys may know, right? This is her cadet nursing program, but they provided for nutrition, books, uniforms. They gave them $30 a month, and they got to live in that nice dorm. But now they were living 2 or 3 people in that nice little one person room. They compressed the training to 30 hours. They had to know about medicine, surgery, pediatrics, and obstetrics, and they had to say that after they graduate, they would either work in a government or a civilian hospital for 6 months to get paid back. There were 1,300 U.S. nursing schools in the U.S. at that time. 1,125 participated from 1943 to 1948. St. James, underneath Sister John Marie, started the Central Nursing School, and she got together St. James, St. John's, and St. Vincent's, and Carroll College and Warm Springs State Hospital applied for this fund and started doing the nursing program. Out of that, 93 nurses from St. James graduated in the program, and 46 out of that 93 were from Butte. That was dissolved in December 31st, 1948. Mary Lou, anybody recognize that name? This is John's mom. They graduated from that group. And there's a whole section in the book about the cadet nursing program. This is what they look like. Ellen Crane and Andrea McCormick interviewed 6 of these nurses. Anybody in that group you recognize, Bernie?
Yes. Yes.
His mother-in-law is here. Alice O'Leary, I'm sure a number of you probably remember Alice. She was a great nurse here in Butte too. And Mary Munger, who actually is the star of all the nurses, I think, that ever came out of St. James. But they reported that it was affordable, available, and very glamorous. Can you imagine being a nurse? But then they had to wear outfits like this at some point in their life. The inactivated nurses were encouraged and sometimes drafted to return to their professions, and Alice Novak was one of these nurses that I'd like to highlight. Mary Munger was another one. Mary was born in Butte in 1923, Her father was a hoist engineer in the mine, and he died in 1936. She was 13 years of age. Her mother had to support not only Mary, but three sons. She went to Immaculate Conception Grade School, Girls Central High, and then St. James nursing program in 1944. She became one of those Army Cadet Nurses, and after that she went and got a degree in public health at the University of Minnesota and her BSN from MSU. She was the executive director of Montana Nurses Association from 1955 to 1971. Remembering back her Butte past and the union activities, she actually lobbied the Montana legislature to pass the blue-eyed nurse bill, named after her because of her blue eyes, protecting the rights of nurses to bargain for safety in the hospitals and also for wages and stuff. That was signed into law in 1967. Rock star, huh? This is the School of Nursing in 1951 to 1960. One of the things that happened in 1952 during that period of time, Murray Hospital closed, but 1960 St. Silverbow General opened. During that period of time, the nurses would go to the intensive care unit at Montana State Hospital in Warm Springs to observe electric and insulin shock therapy. And in 1953, that was revolutionized by use of tranquilizers. When I went to school in the 1970s, though, we were still using electric shock therapy. The State Tuberculosis Sanitarium provided also education and training. In 1960, though, I'll point out that St. James Community Hospital or 1950, it was opened, okay? And the reason why is because the Four Sisters came to talk to the Anaconda Company, okay? And asked for them to increase the amount of money they were getting paid. They said, no, we can't do that, we're gonna build our own hospital. 10 years later, they came back and the nurses got St. James Community Hospital and lots of money in debt to take care of that hospital. This is the nurses from 1951 to 1960. This is Roberta Dabb, and I was hoping that she might be here to tell you a little bit about her experience living in the dorms and during the period of time of that era. In 1961 to 1970, again, 1962 was when St. James Hospital was completely moved over to the new building. They closed down the dormitories. The nurses that were in training then during that period of time, they actually lived in the old hospital. They renovated the miners' wards, and that's where the nurses lived. On the floor below was where the brothers lived. And during that period of time, the administrator of the hospital, the nursing school, was Sister Mary Kelly, and she was born in Walkerville. And her parents, she was the only daughter, but she was born at that other hospital, at Murray Hospital. And one time she asked her mother why that happened. She said, well, the doctor was mad at the nuns. And I think that happened quite a little bit. They'd be moving back and forth. She graduated from St. Lawrence and then Girls Central, and then she did not go to school as at Butte, but she did go to get her RN from St. Joseph's in Denver, and then got her BS from St. Mary's, and then she got her master's in nursing administration. And she was the director for about 4 or 5 years of the School of Nursing here, and she was the last school administrator. One of the things that she talked about was just praying over and over and over how they could continue the School of Nursing, and they couldn't come up with a plan. So they were the first of the last 3 hospitals of diploma nurses that closed. This is the Alumni Association that was formed to honor the nurses. The last centennial celebration was done in 2006. At that period of time, a bunch of these really good nurses got together. They put together this Angels in Nurse book. They also put together a display that is up at the World Museum of Mining that you can still visit, and they put together the display that is in the lobby at St. James. I'd just like to introduce Bernie McCarthy, Deacon Bernie, for just a second to see if you have any questions that you'd like to ask, or Michelle Blakely. Michelle works as a head nurse at St. James in the current. We wanted to let you know St. James is still here providing care.